Hello, welcome. In this video, we will discuss two operations which are performed in patients with complex congenital heart disease. The bidirectional cavopulmonary shunt, sometimes called the Glenn operation, and the related procedure called the Fontan Operation. So let's start. First, it's probably useful to consider what happens in the normal circulation. You might want a brief refresher course on this from our video in this series about the normal heart. So briefly, the normal heart has two separate sides. The right side of the heart collects blood which is low in oxygen coming back from the body. The right ventricle pumps this blood into the pulmonary arteries, which then transport the blood to the lungs where it picks up oxygen. The left side of the heart receives the oxygenated blood back from the lungs and pumps this blood into the aorta, from which the highly oxygenated blood is then distributed back around the body. Now, what's important to point out for the purposes of this video are that first, in the normal heart, there are two good-sized pumping chambers or ventricles. Second, there is complete separation of the blood which is low in oxygen returning from the body through the caval veins, and the blood which is high in oxygen returning from the lungs through the pulmonary veins. We have described the care that children with certain forms of complex congenital heart disease, such as double inlet ventricle, tricuspid atresia and hypoplastic left heart syndrome, receive in the neonatal period. And these are shown in other videos in this series. What most of these conditions have in common is that first, they only have one good-sized ventricle. And second, that after their neonatal procedures, all of the blood which is low in oxygen returning from the body and the blood that is returning from the lungs, which is highly oxygenated, come together and mix inside in the heart. As a result, there is a mixture of the two blood streams being pumped out the aorta and around the body. This is the reason why your baby's oxygen saturation will be less than in the normal circulation. So the next stages in the surgical care of these patients aims to separate the deoxygenated blood coming back from the body through the systemic veins from the blood which is high in oxygen returning back from the lungs through the pulmonary veins. So that after these procedures are complete, the large ventricle is just pumping blood which is high in oxygen into the aorta and around the body. So the first operation to separate the blood coming back from the body through the caval veins and the blood coming back from the lungs through the pulmonary veins is called the bidirectional cavopulmonary shunt, sometimes called the Glenn operation. And this is usually done a few months after birth. The word cavopulmonary refers to the connection made by the surgeon between the superior vena cava and the pulmonary arteries. What's important to note here is that after this operation, there's no ventricle pumping blood to the lungs through the cavopulmonary shunt. For this reason, before surgery, your care team will often do some extra testing to make sure that the pulmonary arteries are not obstructed. This testing is often a CT scan or MRI scan, and sometimes they will examine the function of the pulmonary vessels in the cardiac catheterization laboratory. The exact testing protocol will be different in different children, and I'm sure that your care team will discuss this with you. At the time of the operation, the surgeon will often fine-tune other sources of blood flow to the lungs. They will usually take down a previously constructed Blalock-Taussig shunt, and they may regulate any blood which is coming into the pulmonary arteries from the ventricle. Again, the precise, finer points of this will vary from patient to patient. So once this operation is complete, the blood which is coming back from the upper part of your child's body through the superior vena cava is now going directly to the pulmonary arteries and onto the lungs. It's no longer mixing with the highly oxygenated blood coming back from the lungs through the pulmonary veins. Nonetheless, the blood returning from the lower part of the body through the inferior vena cava is still mixing in the heart with the pulmonary venous return. As a result, the blood being distributed around the body still contains a mixture of deoxygenated and oxygenated blood. And so the next stage of the surgical program, which is usually formed in early childhood, will be to channel the blood returning from the lower part of the body through the inferior vena cava up to the lungs, so that now the blood returning from both the upper half of the body and the lower half of the body is now completely separated from the blood returning from the lungs. This operation is often called the Fontan Operation, named after a famous French cardiac surgeon, Dr. Francis Fontan. The precise type of Fontan operation which is done has varied over the years. Nowadays, the way in which this operation is most commonly done is that the surgeon directs the blood returning from the lower half of the body through the inferior vena cava into the pulmonary arteries through a tube, sometimes called a conduit. Again, it's important to emphasize that there is no ventricle pumping blood through this conduit. And so again, it will be important that before surgery, your care team make sure that the pulmonary arteries are indeed suitable. For this reason, most centers still perform a cardiac catheterization procedure to make sure of this before undertaking the operation. The finer points of this operation can vary from center to center and from patient to patient. One variation which is most commonly used is called a fenestration, and your team will discuss whether they feel this is indicated in your child. The fenestration is a small hole or window that is put into the conduit and allows some of the blood returning from the lower body to pass directly into the heart. Think of it as a sort of pop-off channel. The staged surgical procedure is truly a wonder of modern medicine. It gives a future to children with complex congenital heart disease who previously had almost no hope. There are now many thousands of patients around the world who are living into adulthood after this form of surgery. They're in productive careers and many of them have had healthy children of their own. This is truly remarkable. But in order to make sure that our patients reap the benefits of these procedures and have the best possible outcomes, it's essential that we follow them in the longer term. Therefore, we recommend lifelong care by a specialist in the care of patients with congenital heart disease for all of our patients after this procedure. We hope that you found this video informative, and thank you for your attention.